job cannot be done by the vein. And if the lymphatic were not working, some physiologists estimate we would die in maybe 48 hours,
wow,
or a little bit more, by auto-intoxication and maybe massive edema. And it's a system that moves so many things and so subtle. What I say to my students is, if you want to get a Nobel Prize, try to work with hormones in the lymphatic system, because we know in animals they are responsible for the states of heat, when the animals are on heat, menopause, osteoporosis, a lot of things we don't know. Yeah, and we don't study that too much in humans, and there's a lot of unknown functions. It's very subtle. Even with your hand, it's very subtle to feel. It's connected with your emotional states. It's like little lakes and little rivers. And in our society, the water element is not very recognized. It's just something very feminine, very light, and people don't pay attention to something so sweet and gentle. But it's very, very important. Actually, Alexis Carrel got a Nobel Prize, made a mistake in the experiment, but thought that if you clear the lymph system all the time, you would almost be immortal. And he made a mistake on his experiment, but he thought he could make the cells of the embryo of the heart of a chicken live forever almost with his, the way he was cleaning them.
Well, you know, the first time I heard anything about the lymph system, Bruno, was about cancer getting in the lymph nodes.
Right. That is what we do learn in our medical education. We learn about cancer, metastasis. We learn about immune system.
Right.
We never had the stand. I never learned that, and we're very good education in Europe. I never learned that well the extensive network of vessels going throughout the whole body, how beautiful they are, how gentle they move, low velocity, beautiful transparent fluid, thin little vessel like angel hairs. It's something very beautiful to feel, and even when we do dissection, it's hard to see, but it's a very subtle system. But we know about cancer, and what we know is that some cancer are in the lymph system. They are the lymphomas.
Right.
And some cancer have the tendency to spread through the lymph system, and those are breast, thyroid, lungs, liver, skin, prostate. Some of those have more of a tendency to go through the lymph system than the blood system. They do both. But you have to remember that the lymphatic system is a natural system, and you also have a lot of cancer cells every day in your system. You know that, right, George?
Right.
You have a lot of cancer cells. And the problem is to be able to destroy enough of it.
Right.
If you have, I forget, maybe 3%. If you have less than 3 to 5%, you can probably destroy them with your natural defenses. If you have more, then you are overwhelmed, and the system cannot get rid of them, and you develop cancer. But they are spread through the lymph and through the blood all along our life. It's a natural pathway to eliminate those cells.
Well, you know what's curious to me, Bruno, is that as important as I'm coming to understand the lymph system is, and you know, in looking at your work and what you accomplish with it, it's really it's curious that the medical profession hasn't done more with this. What is it that sets it outside of, I don't know, is mainstream the right word, or what sets it outside?
Yeah. Well, it's a very good question. It's totally appropriate. You know, the venous system is important, right? The veins are something, but in history we start with cardiovascular, so we start with do a lot of arteries. The specialty called phlebology for the veins, I think you have the same words in English,
right,
came very late. And recently we have lymphology. Why? Because you can cut a lymph vessel. You're not going to die right away. So you know, people, and it was discovered very late in history. It was discovered in 1622. We discovered the presence of the lymph system in the body in Italy. But in 1624, 26, we had Harvey, who discovered not the existence, but the real functioning of the heart and the circulation of the heart. That was discovered. The physiology, the function of the blood system was discovered about the same time that we discovered the mere presence of the lymph system. It came very late, very hard to understand its immune function. It's very subtle, and when you do dissection, you need to inject a dye. You don't see the lymphatics as easily unless you inject a dye or inject it unless it's in the abdomen. But usually you don't see them, and so it's hard to study.
Okay, that makes sense. How does, excuse me, I got something in the air here. How do you connect the lymph system with your brain work? What's the connection there?
Well, actually, there are two different separate curriculum.
Okay.
The lymph system, I begin to really push the envelope because people was really working on the muscle, on the skin. I begin to develop some technique for all the viscera, the spleen, the prostate, the lung, the thyroid, and I begin to work with the meninges, the envelopes of the brain. We have three meninges, and there is lymph system, there is lymph vessels in the dura mater and the pia mater. And I begin to work on those layers, and then I begin to naturally enter to the amazing kingdom of the brain and consciousness. And I begin to have amazing results, and I couldn't believe what I did, and I begin to spread it, and I begin to teach it, and I have, every school, a lot of osteopathic schools in Europe, and a lot of people ask me to know about this brain. It's another breakthrough in terms of manual therapy, a place when we never wanted to go. I mean, we didn't know how to go through the skull into the brain tissue with our hands, and it's a question people ask how we work on the brain, but with experience, we develop a touch to feel the lymph and then to feel the viscera, and you can feel, even if you feel a bone, you never feel the bone directly. You feel a bone through the muscle, through the skin, through the fascia.
Right.
But then you develop, with your hand, you can separate and say, well, this is duodenum, this is pancreas, this is gallbladder, and eventually you develop that through the ribs. And you can say, well, I have the lungs, the fissure of the lung, I have the heart, I have the cavity of the heart, the valve of the heart, through the thorax, and eventually with advanced training, you can feel different consistency, density, reaction in the brain itself. So it's for advanced practitioner, but the results are amazing because the brain is really a core element, a primary problem that can release things all the way to your toes, because your brain, spinal cord, the spinal and cranial nerve, going all the way to the endings of the skin, will influence everything in your body.
So let me see if I've got the right visual. The work that you do, the touch work with this, you're touching the skull and feeling the brain, and you're able to feel the other organs at that point, or are you in the body?
No, it's totally different. We train about, I forget, 500 practitioners or maybe a little more. To feel the central nervous system, the tissue of the central nervous system, which is the first level is more the brain. Level 2 we go more in spinal cord.
Okay.
Level 3 we go more in the nerves and the autonomic nervous system, ANS, autonomic nervous system. And so they feel that, but those nerves are going to influence muscles, arteries, veins, fascia, viscera, joints, and the reaction will be throughout the whole body and pretty dramatic. I learned a lot of system when I arrived to the brain. It was a no man's land practically, and to go in that detail and release that much is still really spectacular for me, and so non-invasive. I use the brain every single day. It's something that is very important to have as a tool to release problems in the body, lower back, shoulder problem, eye problem, to headaches, epilepsy, cognitive function, ADD, anything like that, memory problem.
So you trace the source of all these things back to the brain, and then you make the cure from there out, is what I'm hearing.
Yeah, I'll give you an example. For example, the low back problem.
Right.
There's a lot of different cases. There's a lot of things that rotate here and there, but very, very common. You have a brain that has been affected by birth, by trauma, car accident is very common, by toxicity. It could work in a factory with toxicity. You could be intoxicated by chemical products you used to develop your own photos, or smell. Your mother used to smoke when you were pregnant and you get nicotine, or anything like that will affect the brain. The brain is going to be going the wrong, rotating, side bending, we say, is going to be located in the wrong place in your skull. And very often you go anterior on the side, and by doing that, it will pull with it the spinal cord. The spinal cord is attached to the sacrum by what we call the filum terminale, and it's going to pull the sacrum, lock it in a position, and then you're going to do a movement, and your lumbar are going to be inflamed. You're going to have a disc because there's no space anymore to compensate. The sacrum is stuck up, and you cannot compensate. So people.
Well, let me just stop you for just 1 second. Tell us about the sacrum, so that our viewers will understand.
The sacrum bone. Yeah, the sacrum is that the triangular bone at the bottom of your lumbar. So this bone just above your, what we call the gluteal fold, and we call that the crack.
Okay.
But it's just around there. And
the crack in consciousness? No.
What do you say?
I say the crack in consciousness. I was making a poor joke here, Bruno.
So the sacrum is
So the sacrum is really.
The sacrum is right there, and it's like a fusion of it's 5 vertebrae that are fused that continue the spine, the lumbar spine. The lumbar spine is what you have in the curve of your back, and this is going to pull up eventually, pulled up by the brain all the way up, and compress your lumbar.
Wow.
So you go to an exam and you do have problem with your disc and you do have compression, but that is just something often come from the top. So I have all those complicated cases that nobody can heal, that have that problem. They have to go to surgery. Sometimes they give me 2 days. This is, you don't fix it, 2 days I go to surgery. And, you know, sometimes it's the brain. And very often I realize that if I release the brain, put it back in place, relax the tension all the way to the spinal cord, the sacrum drop, the disc have more space between the lumbar, and often that's all it takes to release back pain. And so we need to do more study to be more, to be able to affirm that more positively. But it's very common for me to help these people this way. And also, this is a little bit the same kind of case in what we call tethered cord. You know, the tethered cord is also some syndrome some syndrome when you have. Sometimes they think maybe scoliosis. It's the same case when the spinal cord is pulled up. And so there's a lot of things showing that kind of case, but the brain will pull. You know, it will pull. I don't know if you've seen on the picture. Look, if you can see my shirt, it's going to pull everything. And
right.
You can have frozen shoulder to carpal tunnel syndrome to any kind of restriction anywhere is going to pull on one side through the spinal nerve and cranial nerve, going all the way to the periphery, through the receptors at the end. They will grab the tissue like claws and bring everything in tension. And you're going to release those tension through the brain and through the autonomic nervous system, that is the sympathetic system, especially bring a tone and bring the muscle into hypertone. Too much tone in the muscle and the fascia. All those tensions are usually created by the sympathetic system, the fight or flight system, that is controlled partly by the brain.
So the sacral work that we're talking about in that,
right,
has that suffered